I'm Amanda Olson from IntimateRose.com, and I'm a physical therapist specializing in pelvic floor rehabilitation. And here at Intimate Rose, one of the questions that we are commonly asked is how far the weight should be placed inside the vagina, and how do you know if you're using it right? So the weight goes in just like a tampon would, and you want to insert it so that all of the weight is inside the body. So you'll notice there's a transition coming down the weight, and then there's a little bit of a ledge, and then it becomes part of the string. So it wants to be placed up to the point where all of the weight is being covered. If you feel resistance, so if you're going to put it in and you feel resistance before you get to the end of the weight, if it's painful, you'll want to stop and probably visit a physical therapist specializing in pelvic floor dysfunction. If it's not painful and you feel that you can gently put the weight in a little bit further, then that's okay. Sometimes different anatomy can lead to the organs settling into the pelvic bowl differently, and they're still mobile, and you're not going to do any damage by pushing the weight in. But if it is painful, you'll want to stop. And then we also hear questions about how do you know if you're using them properly? How do you know if you're doing it right? When the weight is in the vagina, it's going to be sitting in the pelvic bowl here like this. And when you're doing a Kegel, the pelvic floor is going to contract and lift up. So if the weight then is being pushed down and out, then you're not doing it properly. So the weight should be lifting upwards in the pelvic bowl. So that's a very obvious way to know if you're doing it right. If you don't feel a lot of movement, that's okay. Muscles get stronger, and as they get stronger, that movement can become more noticeable. Be sure to check out our other videos on YouTube, and visit intimaterose.com for other educational videos on how to use the weights.